So coming up on Great Day Houston, do you have to go to your doctor's office to get your flu shot? You have a constant dull headache. Does that mean something really bad is wrong with you? Should you remove your old fillings, those silver ones, or wait until there's a problem? This morning the doctors are in and they're making a house call to answer your questions about everything from the medicines you take to what your symptoms might mean. So call us at 713-284-1055 or email your question to greatdayhouston@khou.com. Your appointment with the doctors is next on Great Day Houston.
Traveling in and outside the loop from Memorial to the Medical Center. Information you want to improve your day and make your life better. Live from the Channel 11 studios, it's Great Day Houston. And now, your host, Deborah Duncan.
Health Week continues. We wanted to give you a chance to get some information from the comforts of home. You can call in your question or email us. That information is at the bottom of your screen. So let's meet our panel from Memorial Hermann. We have urologist Dr. Richard Kim, who can also address some general health questions. Dentist Dr. Terry Alani. We have pharmacist Gina Eubank. And want to look and feel younger? We have wellness and OBGYN Dr. Shel. And if Medicare or health insurance is your concern, Veronica Gonzalez can help out with all of that. So welcome, everybody. Okay, question for the audience. How many times do you have a question and you feel intimidated, you just don't want to ask the doctor? You feel like you're stupid or something, right? Raise your hand. You feel like, is that a dumb question, right? Well, there are no dumb questions. I think we can start off with that, is that you all want what people at home and people in our audience to know, there are no dumb questions.
Anything goes.
All right. Okay, let's start off, speaking of anything goes, with some of the questions that were emailed to us. This is for Dr. Kim, and it says, I've heard that cranberry juice can cure a urinary tract infection. Is that true?
Actually, cranberry juice, this is an old wives' tale. If you start getting urinary tract infection, push the cranberry juice and you'll cure yourself. The reality of that is a third of the time you can flush out a urinary tract infection just by fluids alone. There's been lots of studies on cranberry juice. The reality of that, it's probably not much better than water to actually flush out an infection. It's the actual volume that gets rid of the infection. Cranberry juice has been shown to help prevent infections, so it helps prevent bacteria from sticking to the bladder. But anything more than that, stick with lots of water. That's probably better for you anyway. Less sugar.
And of course, if things get really bad, you do need to go and get maybe an antibiotic?
Yes. I mean, if you ever think about it, it's only a third time you can cure it on your own. 2/3 of the time you need to see a doctor and get an antibiotic.
All right. Beverly is on the line. Good morning, Beverly.
Good morning.
And what's your question?
I have IC, which is interstitial cystitis, and I can't seem to get strength or energy anymore since this has happened to me over 10 years ago. And I exercise, I take a vitamin, and it's just really, it's a struggle.
All right, so that's dealing with the bladder. So Dr. Kim, that would be you.
Now, interstitial cystitis is a process where there's an inflammation. Now, it's not limited to the bladder. A lot of people put on a spectrum: chronic pelvic pain. They also have systemic symptoms where they feel tired, weak, and it sounds like if you've had it for 10 years, it's something you've been battling with for quite a while. The problem with interstitial cystitis is we don't know what causes it, and because of that, we don't really know what can absolutely cure it. It's not like I can just give you a medication or do a surgery and you're done. It's something, it's what we call manageable diseases. We have to kind of use a combination of medications, exercise, diet. You know, in terms of your energy levels, a lot of times the interstitial cystitis is caused by a flare or a trigger factor. Things like diet, how much you sleep, your stress levels, these things all factor into that. The other thing is you should look into the doctors. There's new medications that come out which can help treat this. So, you know, check with them regularly. I mean, new developments come all the time. Don't assume that just because 5-10 years ago they couldn't help you, they can't help you today. Okay.
All right. Thank you very much. Okay, we have Carla on the line this morning. Good morning, Carla.
Carla? Good morning.
How are you?
How you doing, Deborah? Glad to be with you this morning.
Well, thank you very much.
Every day, and I'm a New Orleans Katrina.
Ah, well, welcome.
I love your show. I was calling because I have 2 daughters. They're teenagers, and they have like a skin problem. And I was trying to see, I used to use like a Medicaid soap on their face.
Yeah, is it like a psoriasis or eczema type problem?
Yes, ma'am.
Okay. So do you want to, Dr. Lalji?
Sure, absolutely. A lot of teens actually have these issues with skin and with many other issues that are things that we sometimes think that it's just basically the skin, but we need to sometimes look a little deeper and see what other issues may be going on. If it's primarily the skin, and if it's just acne, psoriasis, etc., there are certainly medications that we can use. But what has been found lately is that there are a lot of food allergies that are actually contributing to issues that present as skin complaints. And in our practice in the wellness industry, what we're doing is looking a lot deeper into the person to see what else is going on inside that's presenting on the outside. So perhaps look at their diet, things that they may be allergic to as far as foods that they're taking in, as well as any kind of genetic predisposition. So certainly take them to the dermatologist, take them to a skin specialist and have that looked at, but perhaps also look at what's going on inside and what they're on. Are they on any medications? What their lifestyle is like? Are they doing healthy eating? Are they on the omega-3 fatty acids, the fish oils like we talked about?
And that's the stuff that you can find out with a doctor, and then at times with medications, how it's working or not working. Talk with your pharmacist.
Exactly.
Okay, we have someone in our audience. Hi there, what's your name?
Hi, my name is Michelle. I just had a quick question. I've heard that fish oil pills are beneficial in lowering cholesterol or helping in cholesterol somehow, and I just was curious as to how that works.
Do you want me to take that?
Sure.
Fish oil are your omega-3 fatty acids, and yes, research has shown very clearly that high-dose fish oil does decrease cholesterol. There are a lot of cholesterol-lowering agents that we all are aware of, but what we are not aware of is a lot of those agents actually decrease your vitamin and mineral concentrations in your bodies. So what we usually recommend is certainly try to look at your diet, low cholesterol diet. Exercise is incredibly important, couldn't stress that enough. And then third, of course, essential free fatty acids with the fish oil. Fish oil liquid is actually wonderful too because you can actually have it in much more concentration. And then there are other things like garlic, polycosanol, and things of that nature that lower cholesterol very effectively and safely.
We've heard that fish oil makes you smarter too. I gulp some down. And, I'm still waiting for the results. Maybe it takes 3 weeks to a month, like Gina was saying earlier. All right, we have Gwen on the phone. Good morning, Gwen.
I have a question. I have this sense where I have these times where I smell cigarette smoke. The sense comes through my nose, and I'm in an area where there's no one smoking. I may be in my car, I may be asleep, and I just can't figure out why I have this sense, and it's a very strong cigarette smell.
Okay.
Through her nose or her mouth?
Through her nose. You said it's through your nose? That you're
through my nose.
I'm very sensitive to smoke, so if somebody's smoking down the street and around the corner, I know it. In fact, somebody's doing it right now. But what is that a symptom of? Do we know?
The only thing is if, I mean, is for her mouth or whatever, breath, just get a rinse that has zinc chloride in it, and that will help eliminate any types of odors in the mouth. As far as through the nose, anyone want to take that?
It may be on her clothes, perhaps. Perhaps she's been around something and it's on her clothes. I mean, we maybe just look into that and see what else is in her environment that's actually holding on to that scent.
Yeah, but on the other hand, could be something in her body, how her body's metabolizing something, perhaps? Or?
Yeah, the other thing is some type of odors also deal with neurologic problems. So you got to make sure that you're not having associated headaches, that there's not any twitches, any numbness anywhere. You might think it's cigarette smoke, but it might be something else. And your odor sensation in your brain is very similar to your memory, etc. So if there's other symptoms, you need to see a doctor because you might think it's cigarette smoke, but it might be something worse. So don't let this thing go on for a very long period of time.